Hello, I'm Laura Hilton. I'm HIV nurse consultant at Southend Hospital.
And I'm Tina Penn. I'm one of the HIV clinical nurse specialists at Southend Hospital.
So we're just going to tell you a little bit about our service, living with HIV, and how to refer yourselves to us if you need help. So this is the number 22 clinic where we run our HIV service from. It's a very friendly and formal clinic set in a little bungalow, and it's called the number 22 clinic to maintain patient confidentiality. We're a relatively small service. We have 5 nurses, our lovely secretary Louise, and 2 doctors that work with us part-time. We run all our HIV service from here, so if you ever need to see us, this is where you'll be coming. Okay, we're going to walk through the clinic to show you the clinic. Because of COVID, we're just going to do our hands on the way through.
Hello, I'm Tina, as I said before, and I'm just going to talk you through the changes for people living with HIV. 25 years ago, I was the only person at this service, and I had 17 patients. And I only had that many because every new patient that was diagnosed, another one died of an HIV AIDS-related condition. And I'm very, very happy to say that over the years, treatments have improved so much that we now look after 500 patients at this site, and AIDS pretty much is a thing of the past in this part of the world, and that's due to how excellent the HIV treatments are. They're so much easier to take than they used to be at the beginning. There's relatively few tablets that they need to take, sometimes just 1 tablet every 24 hours. And the drugs that we use now are a lot less toxic than they were, so have very few side effects, and so are much easier for our patients to take. We start patients on treatment as soon as they get their HIV diagnosis, and if they take their medication well, and it is a lifelong treatment, and if they are able to maintain an undetectable viral load in their blood, there's no reason to think that they wouldn't have a normal length of life, just as anybody living without HIV. And the other great thing about having an undetectable viral load is that HIV can no longer be passed on sexually. It also means that it's safe for women to have children, and they can also now breastfeed with additional blood tests during the breastfeeding. There is also the problem still exists that stigma still surrounds everybody living with HIV. I would very much like to say that that will have improved the same way that medical outcomes have improved, but it hasn't. So whilst patients know that they're going to be physically well, they still have to deal with the enormous emotional impact of living with HIV. For instance, do they tell their partner? How do they tell their partner? If they do tell their partner, are they going to get rejected? How are they going to cope in a workplace? How are they going to tell friends and family? So all of that is still very relevant, and that's a lot of what we do here, a lot of emotional support. People can also do any job that they want to do. There was a time when people with HIV couldn't be a midwife or a surgeon, and now when their virus is undetectable, they can do any job that they like. So treatment outcomes are now fantastic, but we're still worried about the emotional impact of HIV. And whilst we don't offer a counselling service, a lot of what we do here is emotional support for people living with HIV. Is there anything you would like to add to that, Laura?
No, just that if you've had unprotected sex, either knowingly or unknowingly, with someone that you later find out is living with HIV, then you can access medication to dramatically reduce your risk of catching HIV. And to do that, you need to ring your local sexual health clinic or contact us. If you want to refer yourself to our clinic, you can do this directly if you're living with HIV, and all of our contact details are here with the number 22 clinic. The number to refer yourself to the clinic is 01702 385641, and I've also put up my personal secure email address and also the number 22 clinic email. If you are a service provider looking after clients being diagnosed with HIV, again, you can refer them to us directly in either of these ways, and we will always aim to contact the patient within 24 hours of diagnosis and start offering immediate psychological, emotional and physical support. I think that's it from us. Tina, anything else to say?
One last word is that your sexual health is your responsibility. Don't leave it to somebody else. Take care of yourselves and make a good informed choice about whether or not you're going to use condoms or femidoms. So take care.
Thank you. Goodbye.